How to Drug Detox, Part 2. Is abstinence dangerous? As noted above, withdrawal can be extremely dangerous and even fatal without proper medical care. In terms of physical dependence, drug addicts, especially long-term drug addicts, can become so dependent on the substance of abuse to function normally that their systems can malfunction in dangerous ways, including the possible manifestation of seizures, which can be fatal, and high body temperature and high blood pressure can lead to organ failure. In the case of alcohol and benzodiazepines, abrupt discontinuation of use is strongly discouraged, as the sudden absence of these substances in the system can lead to fatal reactions. Even in cases where the withdrawal syndrome is not directly fatal, the person going through the withdrawal syndrome can experience such negative feelings and emotions that they can lead to self-harm or even suicide. Furthermore, the consequences of withdrawal can be such that the risk of accidents is greatly increased, while particularly volatile behaviors, which can lead to violence and associated dangers, are not uncommon. For this reason, going through withdrawal independently without proper medical advice and assistance is strongly discouraged, and it is especially important that no one withdraws from a substance on their own. How long does the withdrawal last? Generally speaking, weaning from physical dependence will last between 1 and 2 weeks, although in a severe and prolonged addiction, it may take much longer. And it is important to remember that substance abuse, prolonged use of certain substances, can cause permanent damage to the health of the addict, with symptoms that may resemble withdrawal but do not go away over time. Symptoms will peak after 2 to 3 days and may stabilize for several days but will generally begin to subside in the second week, and in most cases, most symptoms will disappear after 2 weeks. Psychological dependency. You tend to have longer-lasting withdrawal symptoms associated with it. Sleep patterns can be altered for weeks or even months, while disorders like depression can also persist significantly for more than 15 days. If symptoms persist for much longer than this period, the drug user almost certainly has developed post-acute withdrawal syndrome, PAWS, a long-term condition that generally requires extensive treatment to combat. What is a medically assisted detox cure? Medically assisted detoxification is the process of detoxification with the help of certain medications that can make the withdrawal process more bearable. It can mean treating some of the withdrawal symptoms with medication, for example, using hypnotics to combat insomnia. But it can also mean that the user gives up their addiction with the help of replacement medication. What medications are used for medically assisted drug rehab? The drugs used in medically assisted drug rehab will depend on the substance of abuse in question and the nature of the withdrawal symptoms the person experiences. For example, antidepressants may be prescribed to combat depression, especially in the case of long-term withdrawal or post-acute withdrawal syndrome, while, as noted above, hypnotics may be prescribed to combat insomnia. In the case of withdrawal and substitution, heroin addicts may be given methadone or buprenorphine/naloxone, which are opioids similar to heroin but have milder effects and are associated with less severe withdrawal symptoms. Whereas benzodiazepines are often prescribed to counteract alcohol withdrawal. It is essential to note that many medications used in medically assisted detoxification are themselves potentially common and should never be administered by experienced healthcare professionals for more than a limited time. No one should attempt to take them. What are the benefits of drug detoxification? For any drug addict, drug rehab can literally change her life. First, it will break the immediate cycle of addiction and abuse that will dominate the life of an addict. Although withdrawal can be extremely unpleasant, it is not intolerable, and once on the other side, free from the immediate pressures of your system's demand for your substance of abuse, you will feel a great weight being lifted from your shoulders and you can move on to the next recovery phase without your days being dominated by drug buying and drunkenness. What happens after the detox? In drug rehab, detoxification is only the first phase of a holistic treatment program that will be provided to the person during their stay. The next phase is a combination of therapies, both individual and group, during which we will address the root causes of addiction to understand the steps they have previously taken that led to the condition and how to avoid it. And will have defense mechanisms to protect them from the temptation to relapse. They will also benefit from the benefits of a tailored diet and fitness plan to have the strongest possible foundation in terms of physical and mental health on which to approach their recovery. Subscribe our channel for future videos, visit our website holisticmeaning.com for more informative articles.